Hello, everyone, and welcome. My name is Stephanie Holliday. I'm the Customer Relationship Manager of Market Intelligence at Open Minds, and I will serve as your moderator for today. Welcome to our weekly web briefing for elite members of the Open Mind Circle focused on post-crisis business recovery and sustainability. Today, Open Minds Vice President Richard Lewis III will present on opportunistic business development responding to new market needs quickly. Richard Lewis has extensive experience as a behavioral healthcare administrator, business development specialist, and innovator of new service lines for national for-profit behavioral healthcare organizations. Previously, Richard was the Director of Development, Behavior and Addiction Medicine at Southern California Healthcare Systems, or Prospect Medical. There, he was involved in many consulting projects focused on healthcare integration, developing new service lines, and health plan contract development. Richard was also the Executive Director of Strategic Development and Planning at Pathways, Molina Healthcare, a national for-profit behavioral healthcare company operating in 23 states. Richard is a former psychiatric hospital administrator and Assistant Director of Mental Health at San Bernardino County Department of Behavioral Health in California. He has experience in behavioral health program management, clinical operations, strategic alliances, and outcome-based service delivery models for complex adult and youth populations. Just a couple housekeeping reminders before we get started. Your audio will be muted during today's web briefing, but we welcome your questions and comments via the question box on the right-hand side of your screen. You can send your questions throughout the web briefing, and after the presentation, we will be able to answer all of your questions. And the slides and full recording from today's web briefing will be available on the Open Minds website by tomorrow. So with that, over to you, Richard.
Thank you, Stephanie, and good afternoon to those of you hailing on the East Coast. For me, it's morning, bright and early here in California. I hail from Los Angeles. I'm happy to be here with you today. I'm happy to be here to talk about opportunistic business development, responding quickly to market needs in a rapidly changing market, part of the Open Minds Executive Blueprint series, building organizational sustainability and a disrupted market. I apologize, folks, for the technical difficulties there, but it looks like we've got it under control. We're going to talk today in the hour that we have about really how to evaluate market changes, looking for new opportunities for growth, for business development during the time of COVID. We keep hearing that these are unprecedented times, and they surely are, and especially the impact that it's had on health and human service providers across the country, as well as our payers and referral sources. In the hour we have today, we're going to look a little bit at looking to assessing our referral sources to determine ways to increase census and new opportunities with our referral sources. We're going to take a look at our competitors in the market and see what the changes may have been that may be opening doors for new opportunities for provider organizations. We're definitely going to take a look at payers. What are they looking for? What do they need? And what are the potential opportunities working with public payers and health plans? And we're going to talk a little bit about strategic alliances as another way to position and take advantage of new opportunities. So, and we've heard the different sayings out there that, you know, oftentimes crisis breeds opportunity, and unfortunately, the effects of the pandemic on our industry have been pretty significant and very negative, particularly in the financial stability of our provider organizations across the country. So it's essential that as part of moving from sustainability planning now into recovery mode, that we really move as quickly as we can to reevaluate the market that we're currently in and look for ways to get not only referrals flowing, but the new opportunities that may be out there as a result of a shifting market. The impact of COVID-19 on health and human services, again, because of shelter-in-place rules, has resulted in a significant decrease in referrals to provider organizations, partially because of referral source closures, downsizing of services, reduced capacity, transition of staff and employees to remote settings. Social distancing has also taken a toll on the ability of our referral agencies to have the kind of one-to-one contact that they may have had before, whether we're talking about primary care settings or schools, or the other traditional referral type settings that we're used to working with. In any event, the loss of referrals has caused a huge disruption caused by the pandemic, not only to the referral sources, but also to provider organizations in the same way. That reduction in traditional referrals has really resulted in reduced cash flow, employee layoffs. Provider organizations may have closed programs, and really the disruption of a positive consumer experience is something we're going to talk a little bit about as we go through this presentation, because the consumer experience at a primary care setting, at a school, certainly at the referral source level, has been completely disrupted. And same for on the treatment provider side, the disruption that is caused with the providers having to close and having limited capacity for service has really left the client, kind of out in the cold. And we're going to talk about the importance of rebuilding consumer confidence in our services. So, what is opportunistic business development? It really is just the process of immediately assessing a rapidly changing market, in this case caused by the COVID pandemic, and looking for quick ways to not only get your referral relationships and referral sources, making referrals again, but also looking for new opportunities in the market as part of recovery planning for the organization. We're going to look at talk a little bit about our referral sources. We're going to look at our competitors. We're going to talk a little bit about the opportunities that how we assess for opportunities with our current payers. Again, when I refer to payers, I refer to both public sector, county, state contract folks, as well as health plans, and again, a little bit about strategic alliances as part of recovery and repositioning for new opportunities in the market. So what are we seeing? What are some of the initial trends for new services, for new opportunities? I mean, certainly the pandemic has created a huge demand for virtual consultation and telehealth because of not only on the referral source side, but for provider organizations, closures and having to downsize and staff working in remote settings because of social distancing and health and safety rules. We've had to figure out very quickly other ways of being able to serve populations, and certainly payers have been very supportive of telehealth and some of these virtual platforms for being able to take care of their clients and members. Here's just a few numbers, and this is recent data from Beacon Health Options, which reported just a huge increase in telehealth claims and utilization in March. Providers are increasingly interested in learning how to develop telehealth, and an increase in consumers in urban areas starting to look at telehealth as an opportunity for accessing services where that wasn't really a high need for that group previously. And then an increase in our Gen Xers looking at virtual services as a way for accessing treatment and care going forward. The other demand that is really moving a little quicker now than it was before the pandemic. I think is the demand for integrated whole person care approaches, and that seems to be driven by the fact that one of the things that we've realized because of the COVID pandemic is that most folks that ended up contracting the disease had some type of comorbid medical condition, diabetes, chronic lung disease, cardiovascular disease. About half of all Americans suffer from at least one chronic condition. Approximately 75% of folks who have severe mental illness have at least one chronic health condition, and in many cases have two or three. Our IDD population, certainly almost half have at least one, but usually more chronic conditions. All of this to say that the need for whole person care models that address not only behavioral health issues and substance abuse issues or intellectual disabilities, but also address the primary care services is really, really important. And for provider organizations that are looking for new opportunities, many payers and even public sector payers are looking more and more towards these types of models for addressing the needs of complex populations. Here in California, one good example of a COVID-related new opportunity for providers here in this state has to do with our Medicaid long-term care, our long-term care at home initiative. Medicaid here is called Medi-Cal, but really this was an opportunity, this was an attempt by the state to decompress our skilled nursing facilities in response to the COVID crisis by creating a new benefit under Medi-Cal that bundles medical services with home and community-based services so that folks have shorter length of stays in long-term care facilities. Folks can be transitioned quicker from long-term care facilities to home, and really be able to have a lot of the services under a wraparound model at home that they would normally get in a skilled nursing facility. So this is something currently being developed and does include mental health services as part of the benefit. So again, a payer response to service needs in the community because of COVID. This is just another example of that trend. So I'm flipping through my notes here. So rapid response to new market needs and opportunities. I mean, really, we want to be able to reassess our referral development plans, whatever your plans may have been pre-COVID that was likely part of a marketing or strategic planning plan has likely changed because of COVID. So we're going to talk a little bit about, going back and looking at our referral source targets and, reassessing our goals for driving referrals to your programs. Being able to identify payer and referral source challenges to making referrals is another opportunity for new growth opportunities, as well as increasing referral flow or getting referral flow going again. Assessing our competitor strengths and weaknesses so that you can position yourself and offer yourself a competitive advantage in the market is another rapid response. And then payer engagement to identify new opportunities. And we're going to talk a little bit about each of these areas. So reassessing our referral source assessment is critical right now because of the loss of referral flow, because of the health and safety regulations that we've already talked about. It's critical to get cash flow moving again for private organizations to start looking again at your traditional referral sources and maybe even looking at new referral sources. Referral sources have a new challenge in terms of making referrals, and They need to know that the provider organizations out there are ready with some of the new health and safety apparatus that's required now, so that they can make referrals and feel comfortable and safe doing so. Quickly, the framework for, we call it a crisis referral development plan, but the framework for revisiting your current referral sources is really taking a look at all of your referral sources, reintroducing your programs and services to new referral sources. We'll talk a little bit more about that. They need to know you're there. They need to know you're open. They need to know what your services are. Starting to schedule virtual marketing meetings in place of one-to-one contacts that we may have been doing pre-COVID in terms of building relationships with referral sources and payers is very important. Coming up with new ways to do marketing and outreach for our referral sources, and electronic brochures is certainly one very quick and easy way to get the word out and start reconnecting with referral sources, and looking for ways to expand your programs and create new service lines is part of revisiting we're developing a referral source assessment plan. So I talked a little bit about reintroducing your programs. So many changes have happened for provider organizations as a result of the pandemic. Your programs and services, again, you may have had to close certain sites. You may now have limited capacity in certain programs, certain services. Certainly you have more employees that are working out of home right now. Which reduces your ability to conduct face-to-face client assessments. Business hours may be changed, may be different now. You may have staggered business hours or times when clients can come for outpatient visits due to social distancing. You may have staggered times so that waiting rooms aren't full. We're seeing parking restrictions where parking is a little less available for clients, as every other parking space in some cases may be blocked for social distancing. Again, your newly implemented health and safety screenings may have added additional steps to your referral process. Clients need to know what that is, and certainly your referral sources need to know that that's an added step in your referral process and getting those referrals, those clients from a referral source to your treatment site. What are referral agencies looking for in this new, I don't want to say post-COVID era because we're not quite post yet, but as we're in this recovery time, referral sources are looking for easy ways to make referrals. They're looking for easy ways to help get the clients that are at their primary care setting, soon to be the schools when they open, whatever the social service agencies, they want to get the clients to your site for the treatment that they need. Digital communications, we're going to talk about in a minute in terms of being able to electronically get information about your programs and services out there quickly. Updating your website is something that they're looking for, being able to go to your website and quickly and easily accessing information that they need to make referrals. Virtual screening and assessment, if that's available, it might be something you want to consider developing. When school districts open, we want to kind of start thinking proactively. There may be less staff. There's certainly going to be less students. How do we get a client in a special education program, from assessed by a counselor and into your program? It may be a Zoom consult between the counselor, the student, and your intake or a therapist at your shop that does a preliminary screening to be able to get clients moved into services. Virtual tours of programs are things that referral sources are looking for, and especially clients. want to be able to go to a website and click a button and kind of take a look at what your programs look like, especially if you're providing residential treatment, for example. Online scheduling for appointments, anything that makes it easier for the client to be able to make an appointment or that referral agencies can connect clients to is important. And we're seeing even an increase in online portals for making referrals. Is there a way that on your website you can have a pre-screening tool that clients, for example, parents that have a child or adolescent they want to bring for service can complete to kind of get the ball rolling? Again, we may not have the capacity in waiting rooms to have folks sitting there filling out forms. We certainly don't want to create any more inconvenience. So online portals for preliminary screening forms and those types of things are certainly recommended. So we talked a little bit about the digital tools. How do we communicate and get the word out about our programs and services? And again, this is all part of developing those opportunities to look for new opportunities for new contracts, new business, new service line development. First, re-engaging our referral sources and our payers. And one way to do that is through electronic brochures. It's a way to quickly get the information out to referral sources and to payers. And we'll talk a little bit more about that in a little more detail, but just something that has basic information about your programs and services so they can see what you have available and what's open, what the protocols are for client visits to your site or admission into, for example, inpatient or residential settings. Reassuring referral sources, reassuring clients, reassuring payers that as a provider organization, you have implemented all the health and safety protocols. You're using PPE, you're taking temperatures as folks come in, we're doing social distancing, everybody's wearing masks. These are the things that now need to be put into your brochures, need to be added to your website, so that it makes people feel a little more comfortable about coming to visit you. Updating your website is probably even more important now than it was before the pandemic. The ability for referral sources, for payers, for consumers to be able to go to your website and easily see what your programs look like. How do I make a referral? What funding sources do you accept? How do I make an appointment? Can I take a virtual tour? Real quickly. Is there some something in there that's showing the health and safety things that you've implemented as a result of the pandemic? That website is critical for direct referrals. Many health plans will make direct referrals, and they're going to want to go directly to your website to do that. Many payers, like health plans, refer their members to or provider organization websites. So right now, that website really needs to be updated and consumer friendly, so that I easily can figure out how to make an appointment. The ability to make appointments on the website. Again, it just makes it easier for me to do, for a client to do. We talked a little bit about online portals and trying to do some of that pre-screening things before a client comes on site, so that we're not having to deal as much with issues regarding social distancing. Information and engagement. We want to put on our website any new innovations, even our clinical outcomes. And certainly one innovation that most providers have adopted very quickly over the past 3 or 4 months has been telehealth. And if that's something that's new and available, that's definitely something you're going to want to have on your website right in front, so that people know that clients know that that's an option for them. So we're going to leave the referral source piece, and again, getting your referral source, re-engaging your referral sources, letting them know that you're there, showing them that your programs are open, how to make a referral, reassuring we have a safe treatment environment for our clients is really, really important for getting referral flow going. But also when in that process and in those conversations, you're going to be finding out what other service needs they may have as a result of changes in their business or changes in the market that have impacted them. And certainly we're going to want to ask those questions about what else can I do for you as a provider here in your service area. So moving on to competitor status assessment, I'm just going to say a brief word about it, and that is, I think I only put one slide in here with regard to that. And that is that your competitors, as far as provider organizations are concerned, have been impacted the same way your organization has. Reduced referral flow has impacted the business again financially, having to move employees and staff to remote work sites, our inability to conduct one-to-one assessments. All of these things have impacted provider organizations, and it's not only for you but for your competitors. So we want to take a quick snapshot of our competitors, and we want to see, who your main competitors in the market. You want to conduct a brief assessment, whether that's going to their website, making phone calls, talking to other providers in the community, and you want to assess, as quickly as you can, have there been any significant changes with your providers as far as service delivery? Have they had to close programs? Have they downsized services? Have they closed treatment sites? If they have limited capacity, there may be an opportunity for you to pick up some of that business that they're unable to provide and expand services for your own organization. Part of that process is going to the local payers, whether they be public, and that could be, again, county or state, and going to the health plans that are operating in your market, in your service area. Part of your engagement with them is going to include asking the big question, have any providers in my market, in your provider network, have they closed? Have they downsized? Is there an opportunity for me to expand my contract with you, Mr. Health Plan, because my competitors have gone out of business or don't offer the same services before? And your payers will be very happy to have you engage and explore those opportunities. We'll talk a minute about their desire to keep healthy provider networks intact, because they're very invested in keeping services going for their clients. So take a look at your competitors, just make a real quick general assessment and see where there may be opportunity for contract or program or service line expansion for your organization. So we want to talk a little bit about payers, and they definitely are important for new business growth and new business development. And we want to be able to engage them and again, see where we can find opportunities for contract expansion and new growth. Provider organizations, ones that really across the country are very supportive of assisting provider organizations in keeping their doors open, keeping programs operating. They understand the impact the pandemic has had on business operations, and are really wanting to do whatever they can to assist. They want you there open. They've got clients that need to be seen, and I think you'll find them to be very receptive to any outreach or engagement that you involve yourself in. Doing a virtual payer crisis needs assessment is what we recommend as part of our looking for opportunities for new business. We're going to talk a little bit right now about reestablishing referral sources, referrals from your payers, asking for rate increases, exploring contract expansion opportunities for existing contracts you may have, and looking at new service line development as part of looking for new growth opportunities. So a payer crisis needs assessment, or really just re-engaging your payers. It's important to understand what their concerns are. I mentioned a couple of them a minute ago. They're monitoring very closely when you talk, and I talk. I do a lot of work here in California with the health plans and with provider organizations, and they've been very clear about their concern about provider organizations in their network closing and or losing capacity to see clients. They're concerned about the limited consumer access to treatment, which is critical for them. They're concerned about, in some cases and in some markets, the slow transition to telehealth or lack of resources the lack of resources from providers to be able to develop telehealth is something they're concerned about. And all of these add up to the last bullet point, which is if there's decreased access to care or treatment, if there's due to capacity issues at the provider level, it means that many of their clients or members may not be able to get the treatment that they need or assessment at lower levels of care, and that their clients may end up in more costly, more expensive, higher levels of care. And so that's the bottom line for their concerns. But it's important we know that as we engage them and understand what their concerns are and pain points. So conducting a crisis needs assessment right now virtually is probably the easiest way to do it. Everybody, I think, in our industry is now pretty used to GoToMeeting sessions and Zoom calls and Zoom meetings, video conferencing meetings, and so that seems to be the new platform for that's replacing one-to-one contacts with payers, referral sources, and to be able to do our business development activities. So we recommend strongly that you conduct a virtual needs assessment with your key payer contacts using that virtual platform. Working with health plan folks, there's a lot of different players at the health plans. Re-engaging with the contractor, with the folks that are responsible for your contracts. You may want to be working. Those are certainly important for seeing if there's any policy changes on the payer or any new expectations from payers with regard to treatments and services. You may want to be working with your provider network folks who are coming up with the strategies at the health plan for how they're going to adjust and adapt the expectations for the provider network to be able to meet the needs of their consumers and members in the community. Provider relations folks or other folks you want to reach out to if you can, as well as the business development folks at the health plan to start that conversation about who you are, what you're doing, and are there ways that we can work in a little more developing new partnerships. We want to update our payers on again your programs and services. They need to know that you're open. They need to know that your services are still there. They need to know what your new protocols are for intake and assessment and making referrals. And they need to know that you have the health and safety precautions in place so that they feel comfortable making referrals for their members and other folks and other stakeholders they work with. What do we ask for when we're talking to a payer right now? We're looking for, we're asking them about service gaps in the market. Have providers in your network closed? Have they downsized? Are there new priorities from you as a payer now for your provider network that I can solve for you? Are there, if there has been a significant closure of a large provider in your market, can I expand my contract, Mr. Health Plan, and start to provide those services for you, and transition those clients to our programs and services? What are the populations that the plan is serving, and what are the geographic areas that are covered? Those things may have changed because of the pandemic, and we want to know what those populations are. Do they have any plans for network growth to meet new contract needs? And just really plainly just coming out and saying, how can I as a provider in your network do more for you in terms of with my existing programs and services, or through expansion? What are your preferred provider models? If you're not already a preferred provider with the health plan, now's the time to have that conversation with them. Preferred providers in plan or payer networks tend to have slightly higher rates of reimbursement. They tend to get more higher volume of referrals from the health plans because of the alignment of payer provider goals and expectations as part of being a preferred provider. It's a good situation to be in, and so you want to have that conversation with the health plan folks. New value-based purchasing initiatives. We talked a little bit about whole person care models. We're seeing a spike in payers now being even more interested in value-based purchasing models, and you want to have those conversations with the plan, so to position yourself for anything that you may be able to do for them now in a VBR contract or a performance-based contract arrangement that solves a new problem that has arisen as a result of the market shift because of the pandemic. And certainly we always want to ask if there's anything else that we can be doing. Is there another program I can be providing, or a service that you need, and start having those conversations about developing that. Again, we need to re-engage our payers as we're doing our assessment of what their needs are and what the opportunities are for growth. We talked a little bit a minute ago about reassuring them that you're there, you're open, you didn't close. You want to share again all the new health and safety precautions you've implemented, updating them on any programs and services, especially any new telehealth or virtual consultation platforms that you may have started or expanded. Health plans right now have been doing a lot of work to retool policies and procedures and reimbursement models to really support providers in expanding telehealth and virtual consultation for assessment and treatment of their members. And we want to explore again, we want to explore opportunities to expand your current services. We talked about that a minute ago. And really, more importantly right now, or timely, is you want to ask for a rate increase if you're in your current contract. The cost of doing business for provider organizations has gone up. Many provider organizations, because of COVID, have had to increase employee wages. There's certainly a cost attached to health and safety precautions, PPE. You may have had to hire, depending on the type of service you provide, some type of a medical person that's doing more medical type screenings, especially if you're in a residential or in a residential setting, for example. And there's a cost related to expanding your telehealth platforms or starting telehealth. They know that, and we're seeing many payers accommodating provider organizations. Again, they want to help, they want to see you stay open, and you want to ask for a rate increase at this time as part of your assessment, your payer needs assessment. payer referral source update. So again, it's kind of a what COVID has kind of done in terms of for provider organizations and really for health and human services in general. It's kind of a restart. We kind of have to start all over again with re-engaging all of these key contacts to get business flowing again, to expand and grow new business. Your payers are a critical part of that equation. Part of your engagement with them is to, again, virtually through virtual marketing sessions, if you can do them, is reach out to the folks and schedule meetings with the folks at the health plans or the payer, could be a public payer as well, that make the referrals. Call center staff. Let's do a virtual meeting with them. Let's show them our programs and services. Here's how to make a referral. We have all our PPE in place. We have had this change in our menu of services because of COVID. Call center staff at Anthem need to know that. Your care managers at the health plans who make direct referrals need to know the same information. Field-based case managers for health plans would be other folks that you'd want to meet with, and certainly payer account managers, and those are the account managers that may manage large books of business for a health plan. The example I use out here is the payer account manager for Anthem here in California that manages the UC system services. So these are all folks, these are all critical contacts that you want to make to educate payers on, again, your status, how to make a referral, and giving them the tools through your electronic brochures, links to your website, to your online portals. These are all things that they'll want to know you have. That's just going to make it easier for them to make referrals for their members or for consumers. Last note on that, and that is the issue of how quickly can we engage payers, leveraging your payer account manager is the quickest way. Payer account manager in most provider organizations is that person that is the single point of contact for working with the payers. Again, let's use health plans. Everything from referral development to the contracting process, credentialing, coordinating with health plan care managers with regard to treatment issues or access issues. But it's that person that has the relationships already with your health plan at all the different levels. And if you don't have a standalone account manager, it may be somebody on your marketing team or business development team. If you're a smaller entity, sometimes it's your director of intake of admissions that maybe has that role. But whoever is in that role, I'd recommend that you leverage that person and their relationships and contacts to get these meetings scheduled as soon as possible. So service line development, right now, provider organizations need to be nimble. They need to be able to move as quickly as they can to readjust to the market. And that includes exploring opportunities to develop new programs and services, quite frankly. Part of that approach is meeting with payers and aligning with them with regard to their goals and expectations for delivery of service for target populations. Right now, they're looking for solutions that address cost and quality issues for complex populations, even more than they were before. They're looking for customized treatment and care coordination, population health management strategies and approaches, and good customer service and good consumer engagement. They're looking for provider organizations right now. They're in a position to enter into performance-based or some type of shared risk arrangements under value-based reimbursement. That doesn't mean that you have to go into a big capitated contract. It could mean developing a new service line or expanding a service line under a case rate or a bundled rate, which generally works out pretty well for providers in being able to provide more comprehensive services to clients under those models that usually end up in good outcomes and for the payer. And they're looking for providers that can come up with those outcomes, that can track data and can report on those things. Again, the last bullet, as far as the payer is concerned, is they're looking for return on investment. Clients are getting seen early, and we're avoiding, the high cost of hospitalization or other higher levels of care like ED visits, et cetera. So, want to point out one thing, and that is that right now when we're approaching providers, payers, we really want to have a, what I call a solution-focused relationship approach. And that is that, we're approaching payers from the position of how can I solve your problems? It's not about going in there and trying to resell programs that you already have or that you're already contracted for, but it's really about trying to reassess and identify what new pain points they may have right now as a result of the shift in the market because of the pandemic. Payers want to work with providers that bring network value to the provider network, and that basically means that providers have an understanding of managed care and value-based principles from the top down. Top down meaning from the board all the way down to the service line. Payers that can align with providers that can align with payer expectations and goals for fiscal outcomes, for customer satisfaction, for treatment outcomes, provider organizations that have that account management role, right? That single point of contact that I talked about before, someone that they can, a health plan can contact for any problem or issue with regard to their members. I mean, a scenario like this where a provider brings network value, we're really talking about the difference between contracting with a payer and partnering with a payer. And we want to shoot for the partnership with a payer when we're engaging payers right now for developing new services and expanding contracts and meeting their needs in a shifting market. So our last section, and we're almost done, and I'm trying to keep with my time here, and I'd like to think we're on time. Let's talk a little bit about what I call a crisis collaboration assessment. Really means how do we look for new partnerships in the market that may open the doors for new opportunities, in a shifting market. I put here in the little box here, would your organization be better positioned for recovery and growth opportunities from COVID-19 crisis with a strategic collaboration or partnership? Being able to address the integrated care needs of a payer, whether that be a public payer or a private payer in a target market. These are things that we know they're looking for. Does it make sense right now if I'm a behavioral health care provider providing adult services in a large area to partner with a substance abuse treatment provider now and be able to, and whether that be, a merger acquisition, it could just simply be a strategic partnership, just some type of collaboration so that you're able to develop a continuum of care that a payer can contract with you for, under some type of a value-based reimbursement type of a model. The benefits of of strategic alliances, are related to increasing your financial strength, the ability to expand your programs and services, geographically, as well as to maybe new treatment populations, developing those integrated models, as I just mentioned. Primary care is certainly a big one. Primary care, mental health, SUD, being able to combine all those services into one delivery of care system for payers. They're very interested in strategic alliances, help to alleviate maybe some of your provider organizations' service delivery weaknesses by, and may build strength in being able to offer an expanded menu of services. And again, really it's about evaluating your direct market and figuring out what are the payers looking for, and how can you solve that problem and grow your business at the same time by partnering with another provider organization in your service area. A word about collaboration assessment. Finding that right partner for you. A brief collaboration assessment approach would include determining your organization's your growth goals that are probably laid out in your strategic planning, in your strategic plan. Developing objectives and a planning process for developing a strategic partnership. Reviewing the organization's diversity of revenue sources. What are your core service lines? What do you have? What don't you have? Financial status as far as profitability, debt ratio, cash on hand. Assessment of the current market trends and funding patterns in the market. Again, if we're looking for a strategic partner, it's generally as a result of a demand by a payer in your market for a new type of service. And right now it's likely some type of an integrated service, or some type of a performance-based or value-based reimbursement model. You want to develop a go-forward plan that includes a review of various types of collaborations. Which one makes sense. Mergers, acquisitions aren't always the best, are not always the best partnerships. There's pros and cons that you want to look at for all of them. What are the strategic issues of each type of model? The ideal structuring key, you want to identify the ideal structuring key elements for success for each model, and certainly be able to identify a couple of potential partners for outreach. But certainly strategic collaborations is something that we're seeing a lot of right now. More on the side of merger acquisitions as markets have changed and new opportunities have arisen, and certainly as a way for assisting provider organizations that have been impacted so negatively by the pandemic that the financial stability may not be as strong as it was before. We're seeing a lot of new partnerships as a result of just sustainability planning. And so again, I want to talk just and I believe this is my last slide, about growth opportunities with regard to collaborative strategic collaborations. And again, I think most of the time folks are looking for strategic collaborations because they want to be able to create a service delivery platform that is positioned for some type of value-based reimbursement contract with a payer. So finding a strategic partner will open doors for those types of opportunities. There are certainly growing opportunities for reimbursement models that are focused on value-based payment methodologies, everything from case rates to case rates to other types of pay for performance models. The ability to create the ability to find a strategic partner to be able to do some type of value-based reimbursement model, like we've talked about. Certainly To do these things, having a larger infrastructure is going to be required. Having the fiscal reserves and taking on more risk is going to be required, and the ability to offer more consumer services over a wider geographic area are usually part of the formula for these new types of collaborations and taking advantage of new payer opportunities for contract development. And lastly, I put one example of, and there's many, and there throughout the country there's different types. Just one example would be Magellan's Complete Care, which is really based on a whole person care model that is growing throughout the country, certainly currently operating in these states, but really bringing providers together and contracting for integrated delivery systems that integrate primary care, behavioral health, and social service needs to address social determinants. But there's many of them out there with the big plans that are things that you would probably want to look at. And with that, I'm at the end of my presentation.
Thank you, Richard. What a wonderful presentation, a very organized approach that we can start thinking about and as we're looking for growth opportunities. We have a few questions that were submitted by our Open Minds Elite members that Richard, I have on the screen if you want to go ahead and address those for us.
Will do. The question is, if we currently do not have contracts with our local health plans, would you suggest reaching out and conduct a payer needs assessment? The answer is absolutely. With changes in provider networks with health plans, and even again county and state payers, everybody's interested right now in looking at new providers or bringing on new providers into their network. So some provider networks, again, are experiencing providers that are closing or downsizing. And so these are, the payers are very open to right now having those discussions with new providers who want to move into the, in developing new contracts. The second question is, if we're not interested in creating new service lines with health plans, would they consider service line expansion, accommodate underserved populations? The answer is yes. And again, for the same reason I've answered for the first question, and that is that plans are really open to anything right now that's going to help keeping their provider networks healthy. We talked earlier about their strong interest in expanding and growing telehealth and virtual consultation platforms as a way to provide services to clients and so to their members. And so the answer is yes, you definitely want to talk to them about creating new service lines. Question number 3, are strategic alliances and partnerships other than mergers and acquisitions recognized by health plans for contracting purposes? It really depends on the type of strategic alliance. I think for provider organizations that have actually merged or been acquired, it's not really an issue. But for those that have knitted together some type of a strategic alliance or partnership with another provider or organization, you're likely looking at a scenario where one provider may be more of a lead agency and the other provider or the other two providers, let's say, are subcontractors. But the recognition of the alliance in terms of services that are offered will be recognized by the plan, and really what will spur the new contract development for you.
Great. Thank you, Richard. And thank you all for joining us for today's web briefing. I apologize for the technical difficulties in the beginning, but no worries. The slides and full recording will be available on the Open Minds website. And just a friendly reminder, if you really want to put the payers on the spot, we have a presentation coming up on July 14th as an executive roundtable on telehealth What will the payers change post-COVID-19? So you can RSVP on the website at openminds.com to get the Zoom link. And with that, I hope you guys have a wonderful day. Thank you so much.